Good afternoon. My name is Bill Smith, founder of Inseparable. Before I begin, I want to let you know I'm going to be talking about depression, suicide, and the criminalization of mental illness. If I could leave you with just one thought today, it would be this: nobody's worst day should take away their chance to live their best life. This is a picture of my brother Jack and me when we were kids. On the left, he's rocking the bowl cut and the fashion-forward denim outfit. I'm the one with the curly hair and white shoes. In the second picture, we're reading the Eufaula Tribune, the small-town Alabama weekly newspaper that our parents ran, where Jack would one day become the editor and publisher. Jack was a great big brother and a great journalist. He loved telling people stories and always managed to bring out the best in people through his writing. For years, though, Jack battled depression and anxiety. He was eventually diagnosed with bipolar, and 3.5 years ago, we lost him to this illness, and it devastated my family. I love this picture. Jack was the proud dad to 3 children. Here he is with my niece, Sutton. She was 18 when her father died. Like many who've lost someone, I decided I wanted to make a difference in what I see is a broken approach to mental health in our country. I study movements, and like Jack, I like to interview people. So with a team of colleagues, we interviewed advocates, clinicians, people living with mental illness, others. What we heard was universal and overwhelming. Our system is broken. Rates of anxiety, depression, substance use, suicide were going up, made worse by the COVID-19 pandemic, a national reckoning on racism, and the climate crisis. But it wasn't all bad news. We met brilliant people pursuing innovative, promising solutions. You just heard from some. They know what needs to be done, but they don't have the power to do it. So we took lessons from the marriage equality movement, where I was lucky to work for over a decade, and set out to adapt some of those lessons for the mental health field. 18 months ago, we launched Inseparable around a pretty simple idea. The health of our minds can't be separated from the health of our bodies. Yet we allow our health system and our public policy process to separate them every day. We believe that we have the power to change that. We're focused on 3 big problems. The first is addressing the large number of people who need help but aren't getting it. This treatment gap impacts over 30 million people, and closing it means making care affordable, making sure people get what they pay for from their insurance, integrating mental health into primary care, and building a bigger workforce that looks and sounds like the people they serve. The second big problem is the mental health crisis with children all over our country. Things were bad before, and the pandemic made it worse. Too many kids are struggling. So we're focused on putting comprehensive school mental health systems in every school in our country through the Hopeful Futures campaign. The last big problem is what brings us all to Philadelphia today. Mental illness is one of the only medical conditions that we routinely criminalize. Think about that. We all know it starts with a broken crisis response system that ends up putting far too many people into prison instead of into treatment and recovery. Nothing can make you feel more helpless than when someone you love is in crisis and you don't know what to do, who to call, or where to turn. For many, calling 911 is an act of total desperation. And for people of color, dialing 911 can turn crisis into tragedy, like it did for the family of Daniel Prude. Joe Prude's brother Daniel was having a crisis so severe Joe had to call 911. Police responded by handcuffing Mr. Prude, putting a spit hood over his head, and pushing his face into the pavement until he stopped breathing. He was resuscitated at the scene, but later died in the hospital. His death is a stain on our country. Our response to crisis starts with a phone call or a text. 988 is already live on your phones here today, and it launches nationwide in July. This thing is here, and we're not ready. Few communities have robust crisis systems attached to those call centers, which means law enforcement will continue to be the default in-person response for longer into the future than many care to acknowledge. Those in law enforcement know it's not working. Cities across the country are piloting co-responder models that pair law enforcement and mental health professionals. Others are building even more promising systems that don't involve police at all. But we're heading towards disaster if we don't talk about the giant elephant in the room, and it's this: you get what you pay for. Earlier this year, Senator Catherine Cortez Masto and Senator John Cornyn introduced a bipartisan bill that would help address this problem of how we pay for crisis. Their bill would require public and private insurance to cover crisis services and would create the first ever national standards for crisis care. And even though we can get wonky and clinical about this topic, we have to talk about the people that this law will help and the communities that it will enable to develop, expand, and sustain crisis response systems. We have to make it personal and talk about the care that every one of us would want for the people that we care about the most. We need to pass this law so we don't lose the future of crisis response before it even starts. So today, Inseparable is partnering with Fountain House and other mental health groups to launch a new campaign called A Better Response. Our goal is to build awareness and support for a better response to mental health crisis. We hope you'll join us by going to abetterresponse.us. For me, and I know for so many of you, getting this right is deeply personal. A few months ago, the little girl from one of the pictures I showed you, my niece Sutton, graduated from the same college I did. She has a lot more of those honor cords than either Jack or I did. She's now a student at Yale Divinity School and wants to spend her life in service of others. Sutton and the next generation give me hope. Hope can lead us to do remarkable things. It can help us to transform our broken systems so that we give people the life-saving care they need. It can help us put people on the road to happiness and fulfillment. But my friends, hope needs a push. It needs you and it needs me working together to build a movement that allows us to take better care of each other. Phone calls, letters, tweets, actions, and a united voice that show our movement means business and that we want a better response, because nobody's worst day should take away their chance to live their best lives. Thank you.